Greetings, this is Dr. Brian Fallon from the Lyme and Tick-Borne Diseases Research Center at the Columbia University Medical Center. It's my great pleasure to tell you about the 2023 Columbia and Lyme Disease Association Annual Lyme and Tick-Borne Diseases Research Conference. This is a great opportunity to learn as much as you can in a short period of time about the latest research and advances in these diseases. We're going to start off talking about human babesiosis. This will be led by Dr. Ben Mamoun at Yale, who's got some really exciting new findings. This is a keynote talk indicating some potential new treatment approaches to human babesiosis. Monica Embers and Liz Horn will be talking about the use of how to identify pathogens in postmortem tissue using the Lyme disease biobank. Scott Cummins from UNC will be talking about alpha-gal syndrome, mast cells, and tick bites. Alison Hinckley from the CDC will be talking about changes to surveillance for Lyme disease. John Alcott from Hopkins will be talking about persistent symptoms of Lyme disease and how to approach them. Dr. David Petrino, who's a neuroscientist and a rehab specialist from Mount Sinai in New York City, will be talking about his experience with long COVID at the long COVID clinic, which he runs at Mount Sinai. Megan Liebecker, who's a research biologist at the Centers for Disease Control and Prevention, will be talking about diagnostics. Peter Gwynn, who's a research assistant professor from Tufts, will talk about the metabolism of Borrelia burgdorferi and clues that might be helpful there in guiding us to understand Borrelia. Natalie Gukskayan from the Columbia University School of Medicine will be talking about psychedelics and the potential role of psychedelics in various human diseases. I'll be talking about long Lyme and long COVID, showing the parallels between the two, especially as it relates to mental health implications. Larry Afrin, this is day 2, Larry Afrin and Peter Rowe will lead off the first 2 lectures. Dr. Afrin will be talking about mast cell activation disease. Peter Rowe will be talking about managing orthostatic intolerance. Both are respective international experts on these topics, so it's really important and valuable clinical information. Dr. Clemens Sterl from Tufts will talk about the immunology and disease pathogenesis of persistent symptoms associated with Lyme. Angel Davey, who's a science officer, will talk about grant opportunities for researchers. Catherine Bursett from the University of North Dakota will be talking about Lyme neuroborreliosis. Paul Trulias will talk about treating late Lyme neuroborreliosis. He comes from France. He's a professor of neurology, and he's going to be presenting a case series. Bill Padula from Connecticut will talk about peripapillary ischemia as a potential biomarker for early detection of tick-borne infection. And finally, Stephen Rich, who's a professor of microbiology from UMass and Amherst, will talk about potential new Lyme treatment, which he has discovered in his work with cancer. So I hope this is going to be extremely interesting. I know it will be to me, and I hope it will be to you, and I hope you're able to attend. Thank you. This is a virtual conference, so everybody can attend.
Good morning. My name is Shukri Ben Mamoun. I'm professor of medicine, microbial pathogenesis and pathology at Yale, and I'm absolutely delighted to be this year's keynote speaker at the 2023 LDA Columbia Conference entitled Lyme and Other Tick-Borne Diseases, Research and Clinical Advances, 2023. The subject of my presentation will be human babesiosis. This disease is caused by apicomplexan parasites belonging to the Babesia genus. These parasites undergo rapid development and replication within human red blood cells, leading to the disease's characteristic pathological symptoms. During my presentation, I will delve into the significant research efforts undertaken by my laboratory, as well as collaborative work with fellow researchers in the United States and worldwide. Together, we aim to uncover the biology, pathogenesis, and virulence mechanisms of these parasites and gain insights into their survival within human red blood cells. Furthermore, I will discuss the ongoing initiatives aimed at translating this knowledge into the development of innovative diagnostic tests, more efficient treatment options, and vaccines. I look forward to connecting with all of you on this day dedicated to learning and the exchange of ideas. Thank you.
Hello, I am Monica Embers, an associate professor in microbiology and immunology at Tulane University. I'm also a co-chair of the Lyme Disease Association Conference. I will be presenting with Dr. Liz Horn of the Lyme Disease Biobank on the analyses of postmortem tissues from Lyme and tick-borne disease patients. Most of these cases involve neurological disease in some form, and we collaborate with Dr. Andrew Dwork at Columbia University to better understand the pathology of tick-borne diseases. These samples are also used to assess the persistence of the organisms, with the Lyme disease spirochete of primary interest. Each case is a story of a person who suffered from Lyme and co-infections. So our ultimate goal is to learn as much as we can from their tissues so that we can find therapies to prevent further suffering. I look forward to seeing all of you virtually at the LDA conference in October. Thank you.